How would you verify a potential diagnosis of paraneoplastic syndrome? I think this is an area of your expertise particularly.
Many of us who work in the area treat patients with paraneoplastic neurological syndrome, do research in this area, have come together to come up with consensus recommendations for diagnosis of patients with paraneoplastic neurological syndrome. And we've published this last year. What we have tried to do is try to explain what symptoms or what presentations would be at high risk of underlying paraneoplastic autoimmunity or underlying paraneoplastic cause. The other thing we have done is we've highlighted the importance of antibodies or biomarkers, which along with the syndrome can help us make this diagnosis even before the cancer is found. Because what happens in many of these cases, as we were mentioning before, the neurological symptoms come months before the cancer diagnosis. And we think partly this is the case because the immune system is doing such a good job at fighting off the cancer and subsequently getting into this friendly fire where it's attacking the nervous system, that in many of these cases cancer is still limited and is not as readily detectable. So we have to go looking for it, do serial imaging or serial scans in some of these patients. So understanding what syndromes are more likely to be associated with paraneoplastic autoimmunity, and then utilizing the available antibody tests, which are very helpful in making this diagnosis, are the two things I think about. And these have been suggested in the updated PNS care criteria for diagnosis of these patients.
What is involved for the patient in getting those antibodies tested?
I think there is a more important role for the physician to understand what antibodies we should be testing. Many of the labs across the country are offering these antibodies in form of panels. And they've tried to kind of put together these different panels for different types of patients presenting with different manifestations. So the managing physicians, neurologists can order these tests on patients' blood or spinal fluid, and that can help in diagnosis of these patients. That said, I also want to highlight that negative panel does not rule out the diagnosis of paraneoplastic syndrome. I have many patients with paraneoplastic syndrome who don't have a detectable antibody in their blood or spinal fluid, but they have the right presentation, and when we looked for the cancer, we found the cancer. So even though these antibodies are helpful, they're not the end-all be-all. There are cases without antibodies still there. Some of those antibodies hopefully will be discovered in the near future, and there might be others where we might not be able to pinpoint one single antibody.
So the test is from the patient's standpoint, is fairly simple. It's just a blood draw or perhaps a spinal fluid?
That is correct.
Okay. And also the fact that you may have the neurologic symptoms before cancer is diagnosed would lead to early diagnosis of cancer, much improved chances of treatment of the cancer and therefore survival of the cancer, I presume.
Yes, and people have actually looked into this in the past, where it's comparing small cell cancers, cancer patients with the paraneoplastic syndrome versus without. Some of the earlier literature suggested that many of those cancers were diagnosed at an earlier stage, hence had a somewhat of better outcome. Some of the more recent studies have been sort of not along the same lines, but at least there's some literature supporting this idea.